Hello, my name is Hassan Nasser, and I'm one of the fifth-year general surgery residents at Henry Ford Hospital. I'd like to thank SAGES for giving me the opportunity to present our project, which is titled Factors Influencing the Choice Between Laparoscopic Sleeve Gastrectomy and Roux-En-Y Gastric Bypass. I have nothing to disclose. The two most commonly performed bariatric operations in the United States are laparoscopic sleeve gastrectomy and Roux-En-Y gastric bypass, and in 2013, sleeve gastrectomy had surpassed Roux-En-Y gastric bypass as the most commonly performed bariatric operation. The predominance of sleeve gastrectomy may relate to its superior safety profile as well as comparable long-term weight loss and comorbidity remission, particularly when compared with Roux-En-Y gastric bypass. However, interestingly enough, there continues to be significant variability in practice patterns between surgeons and hospitals in terms of which operation to offer to which patient. And the decision in the procedure of choice is multifactorial and includes surgeon preferences, institutional preferences, as well as the patient's choice of which operation they want to undergo. However, we do hypothesize that patients' factors also play a role in that decision. And for that reason, we aim to evaluate patients' factors that influence the choice to perform gastric bypass versus sleeve gastrectomy using the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program database. So we queried the MBSA QUIP database from January of 2015 to December 2017. We included patients who were older than 18 years, and we used CPT codes to select for Roux-En-Y gastric bypass and sleeve gastrectomy cases. We only included cases that were completed with the conventional laparoscopic approach, and we excluded cases that were labeled as conversions or revisions, and we excluded conversions to open, as well as cases completed with the robotic-assisted laparoscopic approach. Descriptive analysis was used to compare baseline demographic variables, comorbidities, and laboratory values, and multivariate logistic regression was used to evaluate the association between baseline characteristics and procedure performed. Looking at the results, a little under 350,000 patients met inclusion criteria, 72.3% of which were sleeve gastrectomy cases and 27.7% were gastric bypasses. Looking at the demographic variables for the two groups, gastric bypass patients tended to be slightly older. There was a higher proportion of females and white race in the bypass group. Bypass group tended to have a higher ASA class with a higher proportion of patients with ASA greater than 3, and there was a higher proportion of patients with BMI greater or equal to 50 in the gastric bypass group. Looking at comorbidities, gastric bypass had a higher proportion of patients with diabetes, hypertension, hyperlipidemia, coronary artery disease, as well as reflux. Kidney disease was not different between the two groups, whereas chronic steroid use was actually higher in the sleeve gastrectomy group. Looking at the other comorbidities we evaluated, venous thromboembolism, preoperative anticoagulation, chronic obstructive pulmonary disease, and obstructive sleep apnea were higher in the gastric bypass group, whereas smoking and hematocrit less than 30% were higher in the sleeve gastrectomy group. Moving on to the results of the multivariate logistic regression, which is represented in this plot. And just of note that we use sleeve gastrectomy as the reference group, meaning any adjusted odds ratio that is significantly greater than 1 indicated that those patients were more likely to receive a bypass, whereas an adjusted odds ratio that is significantly less than 1 indicated that those patients were more likely to receive a sleeve gastrectomy. And as demonstrated here, patients with ASA greater than 3 and BMI greater or equal to 50 were more likely to undergo a Roux-En-Y gastric bypass. In comparison, older patients, males, and African American patients are more likely to undergo a sleeve gastrectomy as compared to a Roux-En-Y gastric bypass. Looking at comorbidities, patients with diabetes, hypertension, hyperlipidemia, reflux, venous thromboembolism, and obstructive sleep apnea were more likely to undergo a Roux-En-Y gastric bypass. However, patients with coronary artery disease, kidney disease, preoperative anticoagulation, chronic steroid use, smoking within 1 year, COPD, and hematocrit less than 30% were more likely to undergo a sleeve gastrectomy. The limitations of our work include its retrospective design, as well as the inability to evaluate other factors that affect the decision making, as mentioned earlier. So the database is limited in the data point it collects, and they're primarily patient factors. So we don't have information on institution or surgeon kind of practices, and that we were not able to adjust for and include in the analysis. Also, there's lack of data to explain the reason why these risk factors influence the decision making. Although several of the risk factors can be explained based on current literature, and example would be the association of reflux with Roux-En-Y gastric bypass may be explained by the fact that there are several studies that show patients who have reflux preoperatively that tends to worsen with undergoing sleeve gastrectomy, and that may kind of sway surgeons to offer Roux-En-Y gastric bypass to these patients as compared to a sleeve gastrectomy. But although we may try to explain it, we really cannot extrapolate that from the data itself. So in conclusion, preoperative patient characteristics are differentially associated with undergoing Roux-En-Y gastric bypass versus sleeve gastrectomy. Older age, male gender, and African American race are associated with undergoing laparoscopic sleeve gastrectomy. BMI greater than 50 and obesity-related comorbidities such as diabetes, hypertension, hyperlipidemia, obstructive sleep apnea, and reflux are associated with undergoing Roux-En-Y gastric bypass. Higher risk patients with comorbidities such as coronary artery disease, kidney disease, COPD, chronic steroid use, and smoking are more likely to undergo a laparoscopic sleeve gastrectomy. Thank you very much for listening. I included my email on this last slide. If you have any questions, please feel free to shoot me an email, and I'll be happy to get back to you.